Hi, I'm Byron Udell, founder of AccuQuote. Health insurance, also referred to incorrectly as health care, clearly continues to be a politicized conundrum that we've been talking about and hearing about for years. And it's something our government continues to struggle with as they look for solutions to get the costs down and expand access so that we can all get the medical care we need, doctors, hospitals, and prescription drugs at a cost that doesn't put us into bankruptcy. The Affordable Health Care Act, ACA, also commonly referred to as ObamaCare, is and always has been, from its inception in 2010, nothing more than a ruse, an intermediate step toward a single-payer system, a system that's been held out by its promoters as the panacea to all our healthcare cost and delivery problems. Now, whether a single-payer system is good or bad, better or worse than we have now, is a separate issue worthy of debate and one that I'll treat later in this discussion. But make no mistake, Obamacare was destined to fail by design. You might be asking, why do I say this? Because while requiring health insurance companies to allow people with pre-existing conditions to buy health insurance without any underwriting, risk selection, or pricing differences may seem like the right and compassionate thing to do, it's simply not a business model that can work for insurance companies. When a sick person walks in with a condition that's about to cost $1 million to treat, and they simply pay their $450 a month for quote-unquote insurance to cover all those costs, it doesn't make sense for insurance companies any more than allowing us to buy car insurance after we crack up our cars and then expecting the new insurance company to pay for the damage that occurred before you bought the car insurance. Yet, that's exactly what Obamacare requires. Not even the government can force companies to engage in businesses that make no sense or that are guaranteed to lose money by design. So what are the health insurance companies doing? Well, as we've seen, they're exiting the health insurance markets in droves. Again, it's important to note that the folks that designed Obamacare knew this would happen. They hoped that when it did, they'd simply come in and say, well, if the insurance companies won't do this, then we, the government, must now step in and assume the role of the single payer. Whether we ever get there to single payer and whether that'll be a good or bad thing, again, is a subject worthy of debate. But what no one seems to understand is the following, and this is the essence of the problem. The cost of health insurance is nothing more than a pass-through platform for the payment to doctors, hospitals, clinics, and drug companies. Most people don't know that by law, 80% of the health insurance premiums you pay in any given pool of insurance must be spent on actual claims. If it's less, the surplus is returned to the customers. The remaining 20% covers the cost of claims administration, distribution costs, and lastly, profit, which incidentally, last time I checked, is averaging just 4.2%, less than half the average profit of the companies in the S&P 500. That's as good as it gets. And if in any given year, the insurance company charges too little and the claims are higher, they actually lose money. It's already a horrible business from a profitability standpoint. Add to that, most of their customers hate them, as does the media and the politicians. It's amazing to me that there are still any companies left doing it. No amount of competition among health insurance companies, across state lines or otherwise, is going to save anyone much of anything. Again, they're already either losing money or working on margins so thin that many of them have exited the exchanges. If you do the math, the only way to lower the cost of health insurance is to lower the cost of the care. That's what doctors, hospitals, and drug companies actually charge, or to render less care. That's it. Lower the cost of the care or render less care. Without one of these two, the costs will never go down. The insurance companies are not the problem, even though it might be expedient to blame them for the rising costs of health care. So, regardless whether we end up with a single-payer system or some other variation of our current system, Obamacare or some other replacement, will doctors, hospitals and drug companies voluntarily lower what they charge for their products and services? I highly doubt it. Alternatively, will we as a society, as a way to control the overall spend on healthcare, be willing to accept less care? I also think not. We've been conditioned to expect that if something is medically possible to treat a condition, then it's therefore medically necessary and should be done and paid for by insurance or by Medicare or whatever. Example, your mother's 74 and needs a new hip. Are you okay with the system run by government bureaucrats making the determination that the surgery won't be done because its cost just isn't worth it? How about your back pain? Are you okay with some bureaucrat telling you to just deal with it because it could be months or years before any treatment will be possible or approved? We all know that the current system has seen annual cost increases in double digits for years. As a result, healthcare expenses continue to represent a larger and larger percentage of our income. It's a mere function of math that if something, healthcare costs for instance, go up at say 15% a year and incomes go up at say 2% a year, interestingly they haven't gone anywhere in the last 15 years, they've been stagnant with essentially no growth, that in just 15 years the annual cost of healthcare or insurance will be higher than all the money we make in a year. Carry this math out 50 years, and the current average income of $53,000 growing at, say, 2% a year will have grown to $137,000, which may sound like a lot of money, but the cost of 1 year of health insurance for one family, starting at today's cost of $12,000 a year and growing at 15% a year for 50 years, would be an unfathomable $9,832,000. Yes, that's right, almost $10 million a year for just one family's health insurance bill. Now, obviously, that's not going to happen, but the tipping point is getting very close already, and the politicians don't seem to have a handle on what to do. What's clear to me, and should be to everyone, is that minor tweaks in our current system are not going to solve anything. So what can we do to get this problem under control so that all of us have access to affordable care? As much as I hate to think about it, here's where I believe it all ends. There will eventually, probably sooner than later, be a single-payer system for basic health care. It'll be crappy like the VA, but everyone will get it essentially free. Of course, we all know that nothing's truly free. It'll be paid for by the government through tax revenues collected from those who actually pay taxes. And in case you're curious, currently, the top 1% of income earners pay a whopping 40% of all income taxes received by the federal government. The top 10% of income earners pay 70% of all the income taxes. The bottom 50% in total pay less than 3% of all the income taxes our country collects. Again, the basic healthcare system will be run, of course inefficiently, by government bureaucrats. It'll have long wait times, horrible service levels, horrendous outcomes, and it'll be a terrible way to stay healthy. But we'll all have it as our basic coverage if we have nothing else. In addition, those who can afford more or better will buy supplemental coverage, much like what was available in the free market before the ACA. The supplemental coverage might be expensive, and it might not accept those with pre-existing conditions. After all, it is insurance, a business, not a social program. So those who want to have it when they need it and can qualify for it and afford it will be well advised to buy it before their health is such that they can't qualify. Is this future system perfect? Absolutely not. But it is what's coming. Get ready for it. I don't see this situation ending any other way. If you do, please comment and let me know what you think. By the way, I sell life insurance, not health insurance, so I don't have a horse in this race. I shared my thoughts on this issue because I don't hear anyone in the political or media world that seems to understand this stuff, and someone needs to tell the truth, whether or not it's what we want to hear. Thanks for listening.